This module is about leadership in public health management. No? In this module, we will learn some basics of leadership in public health management. As we already know that we have leaders in politics, leaders in sports, then leaders in science world. We have leaders in business and richness. We have also leaders in arts and science. But if you see that, we have very less or no leaders in public health. In the Indian context, in the developed world, we have even the leaders in public health. But in the Indian context, we have very less leaders. Because of that, only government will be taking care of this leadership. Okay. There are many challenges in public health. To meet these challenges, we need leaders in public health. What are the challenges? We will learn from future lessons some examples like keeping our clients excited about our services, watch for competitors who seem to come up where you least expect them, make large leaps in working efficiencies, and many, many more. For that, we have to have leaders. We will take you to know public health leadership slowly and gradually. Anybody can become public health leader, and that is the uniqueness of public health. What is leadership? Leadership is a process through which an individual attempts to intentionally influence human systems in order to accomplish a goal. What are the characteristics of public health leaders? They interact, communicate, educate persons effectively from diverse backgrounds, develop linkages and preferences to promote healthy behavior through community participation. He or she should have few more requirements. Who are public health leaders? We know all of them very well, but we have never addressed them as our public health leader. This should be our first job, to identify as public health leader in all our future endeavors. Principles that guide public health leaders. They are meant for delivering core functions and essential services. They provide health promotion and disease prevention. They build community coalitions. Ensuring equity is a principle, and many, many more I will let you know. What are the concerns for public health leaders? The first job is assessment by data, effective decision making. Primary prevention perspectives, that is health promotion. Developing academic and practices linkages. Do a better job in social marketing and health communication. Do a better job in community coalitions. Know few things about styles of leadership. There are many theories to understand the leadership. The first one is theory X, theory Y, and theory Z. There is a managerial grid developed by Blake and Moulton. There is a situational leadership. There is the style spelled out by Bass and Stockdale. Causes and Posner. Lastly, Hersey, Blanchard and Johnson. Talents of public health leaders are relating themes, impacting themes, striving themes, thinking themes. These are the talents. How leaders are different from managers? Managers are effective, whereas leaders are efficient. Managers do things right, whereas leaders do the right things. Let us see what is transactional and transformational leadership. Among the two, transformational leadership is the ideal one. When there are no public health leaders, would you still need meta leadership? Domains of public health. Public health administration at center, state and district and Panchayat Raj institution. Environmental sanitation. Prerequisites of healthy life, water, air, ventilation, food and housing. Family planning and population control. School health. Rural sanitation. Sanitation of camps, fairs and festivals. Social security and health services. Then we will look into what is competency in public health. Competency is leadership, teaching competency, research competency, and management competency. These are the four important competency in public health. The leadership wheel consists of team building, value clarification, mission, vision, goals and objectives, action plan, implementation, evaluation. These will go in a form of a wheel, therefore it is called a leadership wheel. And these are the approaches to organizational changes. Why there will be changes in the organization? We have to find out some reasons. It is internal, national policy, state policy, like Indian Public Health Standards, National Accreditation Board for Health, National Accreditation Board for Laboratories. And because of external funding by World Bank, we bring health sector reforms that will change the organizations. We have global health, international health, and intellectual property rights. Because of that, there will be some changes. There will be a lot of technology influence because of natural calamities, media pressure, market influence, change in the original culture, change in behavior and attitudes. Some examples of mission statement of PHCs. Sensitive, receptive and friendly to patient care. Care of the sick as well as prevent disease our commitment. Taking care of family and community to free from sickness. 24/7 services guaranteed for the sick and also healthy clients. Kind and courteous services are free of charges. Sick women, children and the poor are our priority clients in care. Quick and complete relief from sickness is our magic mantra. Sickness of poor, challenged and vulnerable are our prime concern. Like this, we can develop a lot of mission statement to PHCs. And there is what is called a levels of leadership. Leadership has got 5 levels of level. One is personal level, second is professional level, the third is team level, fourth is organizational level, fifth is community level. How do you assess leadership? There are many methods of assessing the leadership. One is what is called a APEX PH, Assessment Protocol for Excellence in Public Health. MAPP, Mobilizing for Action through Planning and Partnerships. PATCH, Planned Approach to Community Health. PACEH, Assessment Protocol for Determining Community Excellence in Environmental Health. Model Standards. Telephone Surveys in United States. CATCH, Comprehensive Assessment for Tracking Community Health. Public health informatics, evidence-based approach, analytical tools usage, GIS spatial maps, and structural changes. Pilot projects are being taken up by few agencies through usage of mobile phones. Role of leadership in assurance. There are 5 essential public health services associated with the assurance core functions. They are enforcement of laws and regulations, personal health services workforce, population-based services, research. Assurance of leadership. Assurance activities focus on disease prevention and health promotion. Primordial prevention is avoidance of entry of risk factor that may elicit disease. For example, avoidance of smoking and animal fat, consumption of low salt diet. Primary prevention involves creating an environment in which disease will not come into being, the ultimate public health goal. Secondary prevention involves the intervening when problems occur and implementing major initiatives to prevent consequences from becoming worse. Lastly, tertiary prevention involves stopping the progress of a disease or disability in order to prevent dependence. In fact, prevention of health problems is essentially equivalent to public health. Examples of assurance activities can be classified as population-based, mixed, public health-based. Leaders in planning. Leaders can also be involved in planning. Number 1, in community health planning. Number 2, in strategic planning. Number 3, reinventing government. And number 4, public-private partnership. When there is a conflict, what is the best thing to do? Best practices. Avoid conflicts. Know the difference between credentialing and accreditation. We commonly use these two words. Let us have some good meaning of that. Okay. Later on, we will be able to detail about these two aspects. Okay. Thank you very much.